Deanna Resnik on healthcare.
Thank you. So, sick kids can't learn. Sick adults can't work. Homeless kids, kids that are worried about moving from place to place.
Deanna, you may want to pull that mic a little closer to you.
Can't learn. And adults that are worried about their economic means are distracted. And it's a circular issue. And what we find is some pretty dramatic collaboration or correlations between kids who begin to do poorly in school. As they do poorly in school, they engage in riskier behaviors. The more risky the behaviors, the more tendency there might be to dropping out. Once they drop out, you get the whole cycle. So health is very much married to housing and to education, and you have to have all three. For us, health, if it starts in the hospital, we miss the boat. That is too late. So we've got to start early, and we've got to start in our neighborhoods, not in the hospital. And this is why community care, the area that I've worked for all these years, is in the neighborhoods. 1 in 4 of our citizens do not have insurance. If you don't have insurance, you are really going to have a very hard time accessing care. Once you're so sick that you can't work, or your child is so sick that they can't be in school, or you can't keep them home, then you're in the emergency room, then I guess you'll get access to care. But that's a very late stage to access care. And for the preventive piece, without health insurance, you don't have access. So 100% access is a very, very important part of a healthy community. And along with that is the whole understanding of a medical home. So using a medical home, using your neighborhood physician, and the opportunities to get your yearly checks, to get your screenings, to know about your family and your own status in terms of health is very important. There's also a lot of external pieces to healthcare, like talking to our kids about dental care, just basic sealants. When you've got babies, we see a lot of cavities. Cavities should not exist, but they do simply because we're not giving them the fluoride water. They're not getting to understand how to brush teeth, and they're going to bed with a bottle with juice at night. So these are just real simple things. And so when we talk about engagement, when we talk about church involvement, these are basic things that if we could bring into the churches and bring into our fellow brothers and sisters and really talk about, navigate how to do these things early on, we can change the trajectory of their healthcare in many, many ways. We can find things early. We can get them on the preventive side early. So access to care and true understanding of screening and education can all go a long way. For us, it's in the neighborhood, and there's 3 things. One is your involvement in your community. Look at your neighborhood. Look at your own fellow parishioners in your churches, and think about how you might organize or bring screening programs in to the churches, or how some of you might put together an information and referral program so that folks know where to go for different things. Talk about some ways to bring some health topics into places where people come all the time. Integrate into your, prayer meetings or whatever, wherever it makes sense. We have had a lot of success going on Sundays after church and having screenings. And we have found quite a few hypertensives and diabetics, several that we went straight from after Mass to the hospital. That's not ideal. We'd rather find them when we can really educate and then change that outcome. But there are a lot of us that walk around and don't realize all that's going on in our systems. We need to talk to our kids and really understand the suicide rate in Austin is very, very scary for young teens. They're dealing with so much, and we don't have the systems out there to be talking to them, to screen them, to catch them early. The rate of accidents in our children, drownings and fires and basic seatbelts, car seats, those are all things that we could teach each other and work with each other. Helmets for bicycles, helmets for motorcycles, immunizations, vaccines, and enrolling in insurance are all things that can happen in the churches and in the neighborhood, and advocacy. And one of the things is to know if your neighbors know where they can get these different aspects, and if they can't, then how can we organize them and bring them in to the churches where they go. But the whole idea is that's why we do mobile vans, we do mobile mammography. 35% of women in Austin have had a mammogram. 35%. We should be at 100%. So there's still a lot of fear, there's still a lot of folks that just don't understand and don't know. And there's still a lot of opportunity to meet them where they go every day, because the fact is that prevention, when we're juggling so many things, becomes a luxury, becomes a thing that you can forego. And so you do, you skip it. And it needs to be a necessity. It needs to be something that we know is important and that we want to get. Our alcoholism rate, our drug rate, all those things are affecting our kids in school, affecting their ability to be a success, and ultimately all the economic things that my colleague Susan talked about. So health is very, very important. Access by enrollment in insurance, screenings, and taking the time to educate your kids, your neighbors, your friends, all around the things that you can proactively do to take good care of yourself, to take good care of your kids, will make a huge difference in our economic future.
Thank you, Deanna. Just to underscore a couple of points Deanna made, in 2005, the cost in Texas of taking care of those without uninsured was $4.5 billion. It is the cost of taking care of folks who didn't have insurance. That was before we had our economic downturn, so you know that number is significantly more now. The uninsured, many times, sort of like when we think about affordable housing, oh, that's for the homeless folks. Uninsured, those are the folks I see in the corner. 80% of the folks without insurance are either themselves working or part of a working family. So it's a lot of the folks that you see in this room, to your left, to your right, and it's folks that you see every day, in your churches, etc. One of my colleagues at ABBA, when he went out on his own and left his business, understood what it was like trying to go and get insurance as a business owner. It's pretty tough. Many of you guys or gals out there that own a business know how expensive it is and how hard it is to do that. But when you don't have insurance, what you wind up doing is putting off needed health care. You don't have the primary care home. You don't get the preventive checkups you need. You may have heard yesterday in New Orleans they had the free clinic, and I don't know how many folks, hundreds of thousands, maybe not quite, but thousands, tens of thousands of folks that were there. 98% of them walked away with a diagnosis from cancer, hypertension, type 2 diabetes. They were all walking around with this, but because they didn't have access, they didn't go anywhere. And it's 3 times more expensive to get the same care in the emergency room than it is in a private doctor's office. And that cost has to be borne by somebody, so it impacts all of us.